This Medical Minute sponsored by Avera.
For individuals or families experiencing a mental health crisis, finding the proper help can make a big difference. So what are those options?
In Sioux Falls, one resource is behavioral health urgent care at Avera Behavioral Health, which is specifically designed for those facing an immediate crisis. Thomas Otten, Assistant VP of Avera Behavioral Health Services, explains how it works tonight.
So when talking about resources, what kind of resources does behavioral health urgent care offer?
Yeah, so behavioral health urgent care really functions 24 hours a day, 7 days a week, very much like a psychiatric emergency room. We don't call it emergency just because it doesn't meet the trauma standards of an emergency, but what it does do is it provides counselors, nurses, behavioral health technicians, and advanced practice providers there 24 hours a day to help resolve any kind of crisis situation. So anybody who's having a behavioral health crisis, it's the perfect place to start as kind of the easy button, if you will. We want to make the behavioral health world easy to navigate, and a lot of times people don't know exactly where to go, so we wanted to make it easy for people to identify where to go. When you come in, you would be triaged by one of our nurses. They'll make sure that you're in the right place, and they'll get vital signs and those pieces. We'd have the patient go to one of the rooms and meet with one of our assessment counselors. So they'd be meeting with someone who would do a biopsychosocial kind of evaluation of what's going on, what are all the precipitating events, what's the crisis that's happening currently, and then we'll work to set up a plan for that patient. The APP will come in after the counselor, so either a nurse practitioner or a PA. And between those three disciplines, the nurse, the counselor, and the advanced practice provider will set up a plan. Do they need to be seen by a counselor? And we'll try to help give recommendations of where that would be. Or do they need to be seen by a psychiatrist? Or do they need to be in our partial program? Or do they need to be admitted to the hospital? Whatever level of care they might need, we'll help give them the plan and help them along the way.
Can you perhaps give us a perspective of how this need has been accepted in the community and how urgent it's been?
Yeah, it's been a huge need in our community for a long time. And one of the evidences of that, I would say, is over the first year, we served well over 6,000 patients who came to our urgent care in exactly that crisis. And just as I think anytime you're in that crisis, it's hard to know exactly what to do. The navigation of behavioral health is not always easy. I mean, if we have a medical problem, we know to go to the urgent care or to go to the emergency room. In behavioral health, it was never really easy or well known where to go. Emergency room certainly ended up being the default for some patients. But I think, it probably is not an environment that's set up well for psychiatric crises. It's set up very well for medical crises. And I think we wanted to have a kinder, gentler environment for behavioral health patients. So it's been a huge win as far as helping patients navigate the system easily.
And for more information on behavioral and mental health services, be sure to visit avera.org/medicalminute.